The early settlers to North America were some of the toughest survivors the world has ever seen. When these haughty souls journeyed across an unsettled continent to homestead in the wilderness, they carried little more than hope, grit, and whatever supplies they could fit into a wagon. They had no guarantee of food, water, or shelter, let alone access to modern medical care. Illness and injury were commonplace, and only those who knew how to patch themselves up could survive. Today, we're going to learn about the frontier healers, the resourceful people who not only survived, but thrived on the frontier by using ingenious remedies passed down through generations or discovered through trial and error. We will explore their fascinating world of herbal remedies, surgery without anesthesia, and treatments for everything from snake bites to melancholy. So stay tuned and get ready to discover the amazing ways that frontier healers kept their communities alive. Before the days of modern medicine, frontier healers relied on a vast array of herbs and plants to treat a variety of ailments. Herbalism was an integral part of their practice, and they used everything from common garden herbs to rare mountain blooms to help their patients. One of the most popular herbs used by frontier healers was slippery elm bark. This bark was often made into a tea that was used to soothe sore throats and coughs. The mucilage in the bark would coat the throat and provide relief from irritation and inflammation. Another powerful herb was lobelia, which was used to treat respiratory conditions such as asthma and bronchitis. Lobelia could be inhaled as a steam treatment or taken as a tea to help open up the airways and reduce inflammation. For women's health issues, frontier healers turned to a variety of herbs, including raspberry leaf, which was used to strengthen the uterus and prevent miscarriage, and chamomile, which was used to treat a variety of female ailments, including painful menstruation. They also used herbs to treat digestive issues such as indigestion and constipation. Herbs like peppermint and ginger were used to soothe the stomach, while herbs like senna and rhubarb were used as natural laxatives. Frontier healers also used herbs to treat skin conditions such as rashes and insect bites. They would make poultices out of herbs like plantain and comfrey to soothe the affected area and promote healing. It is important to note that not all herbal remedies were created equal, and some could even be harmful. For example, while water hemlock was used by some healers to treat a variety of ailments, it is actually one of the most poisonous plants in North America and can cause severe illness or even death. Despite the risks, frontier healers were some of the first to recognize the power of plants and their ability to heal the body. They developed a deep understanding of the natural world around them and were able to use it to their advantage. Their knowledge was passed down through generations and continues to influence the field of herbalism today. While herbal remedies were a staple of frontier healing, there were times when more drastic measures were needed. Surgery was sometimes necessary to treat injuries and illnesses, and frontier surgeons were up to the task. But unlike modern surgeons, they did not have the luxury of anesthesia. Surgery without anesthesia was a painful and risky undertaking. But frontier surgeons developed techniques to minimize the pain and maximize the chances of survival. Before the invention of anesthesia, surgeries were performed using a combination of methods to control pain. Some surgeons used hypnosis and suggestion to put their patients in a state of trance, while others used strong doses of alcohol or opium to render them unconscious. However, these methods were not always effective, and many patients were wide awake during surgery. To help control the pain, frontier surgeons developed techniques such as performing surgeries in cold weather, which would constrict the blood vessels and reduce bleeding. They also developed new instruments to perform surgeries more quickly and efficiently, minimizing the amount of time the patient was in pain. Despite these efforts, surgery without anesthesia was still an incredibly painful experience. The lack of pain management also led to higher rates of infection and mortality. But frontier surgeons were dedicated to helping their patients, and they were willing to take on the risks that came with performing surgery in such harsh conditions. Their skill and ingenuity saved many lives and helped to advance the field of surgery despite the limitations of the time. But surgery wasn't the only medical procedure performed on the frontier. Frontier healers also practiced bloodletting, which was the practice of withdrawing blood from the body to cure various illnesses and ailments. Bloodletting was based on the belief that illness was caused by an imbalance of the body's humors, or fluids, and that removing some of the patient's blood would restore the balance and cure their ailment. While this practice may seem barbaric by today's standards, it was widely accepted and used by medical professionals throughout history, including in the United States until the mid-20th century. There are several methods of bloodletting used by frontier healers, including leeching, where live leeches were applied to the skin to suck blood out of the body. Cupping, where cups were placed on the skin and heated to create a vacuum that would draw blood to the surface. and scarification, where the skin was cut or scraped to remove the top layer and allow the blood to flow freely. While bloodletting was generally considered safe when performed correctly, it could also be dangerous. If too much blood was withdrawn, it could lead to weakness, fainting, and even death. However, frontier healers were trained in the practice and knew how to perform it safely. They believed that bloodletting was an effective treatment for a wide range of ailments, including fevers, headaches, and even mental illness. Despite the controversies surrounding bloodletting today, it was an important part of frontier healing and helped to shape the medical practices of the time. While frontier healers were skilled in treating a variety of ailments, there were some conditions that were particularly common on the frontier. One of the most widespread ailments was snakebite. With so many species of snakes in North America, it was not uncommon for settlers to be bitten by venomous snakes. Frontier healers had to be knowledgeable in the treatment of snake bites and act quickly to save their patients' lives. They were trained to identify venomous snakes and knew the best course of action if someone was bitten. Treatment for snake bites typically involved sucking the venom out of the wound, applying a tourniquet, and then performing surgery to remove the bitten limb. While these treatments were not always successful, they were the best options available at the time. Another common ailment on the frontier was melancholy, which was the medical term for depression and other mood disorders. Frontier healers recognized the importance of treating mental health and developed holistic approaches to help their patients. They understood that melancholy could be caused by a variety of factors, including physical illness, grief, and stress. And they developed treatments that addressed the whole person, not just their symptoms. These treatments often included a combination of herbal remedies, rest, and a change of scenery. In addition, frontier healers were some of the first to recognize the benefits of exercise and fresh air on mental health and encourage their patients to spend time outdoors and engage in physical activity. While the treatment of melancholy was not always successful, frontier healers were ahead of their time in recognizing the importance of mental health and developing holistic treatments to address it. In conclusion, the frontier healers of early America were some of the most resourceful and innovative medical practitioners of their time. They developed ingenious remedies and treatments using the natural world around them, including herbal remedies, surgery without anesthesia, and alternative therapies such as bloodletting and treatments for snake bites and melancholy. Their knowledge and skills were essential to the survival of settlers on the frontier, and their practices continue to influence the field of medicine today. By learning about the frontier healers, we can gain a deeper appreciation for the challenges and resourcefulness of the early settlers and the ingenuity of those who came before us. You can click this video on the screen now for more information on early American survival. Thank you for watching. Stay safe.